This is one of the smallest ever created, and this is the first one to be placed in the brain. So if you think about Neuralink and Elon, good old Elon, his device is a coin-size system, not a big coin, and it's got wires that go into the brain. There's no wires on this. It's a different type of application, but all of the brain-computer interfaces and other implanted devices in the brain are bigger than this. So this is also the first one ever developed that sits directly in the brain and doesn't have any electrodes or tethering system or wires or batteries or moving parts. So it is completely unique in that setting. So the neurosurgeon Peter Heppner and I first had a coffee conversation about this 14 years ago. And you know, these things take time to gestate. Grant funding through to the University of Auckland, large-scale grant funding, probably had about 15 million of taxpayers' investment, charities as well that invested in this project. Kitea Health did a seed round a couple of years ago. That's funded where we're at to date, being able to fund the first early feasibility trial. But the next phase is actually a Series A round, raising maybe up to 20 million New Zealand. Broadly speaking, our aim is to change the way we treat and manage people that have lifelong health conditions. Those conditions are where you are often going to the GP or to the hospital, and currently it's always reactive care. You wait until your symptoms get worse and then you go to the GP or hospital. And so we argue that actually by monitoring the physiology, by monitoring your condition remotely and at home, we can provide an early and better detection of your clinical path or treatment and really help in that. Physiology is where it's at, and we are monitoring pressure directly in the brain as an early warning system or a detection of whether the shunt is working correctly or is failing. Because when it begins to fail, fluid begins to accumulate and pressure goes up. So what we've made is this little tiny sensor. It's 0.3 of a gram, and it goes into the brain, into the cortex, at the same time the shunt is placed. So it's not designed to be another surgical procedure. It piggybacks on the existing procedure. And the idea is that sits there, and then someone at home, once they've gone home, they've done well, they can come along and take a daily measurement of their brain pressure, daily or weekly, as required, or when they're symptomatic as well. We're a little bit of a square peg in a round hole. You know, if you're familiar with, most of them are thinking SaaS company, revenue, that sort of spin up. And when you come along and say we're not about revenue, we're about regulatory and treating patients, that's, doesn't always fit in the equation. So we've had a few go, I don't really understand it. We'll broaden out to be international investors, but having local investors is important to me, and trying to keep as much of the local, because we're employing a lot of people and we'll employ a lot more as we go on. And the more we can do here, the better off everyone will be.